now, depending on how the style of this midwife's setup is, what I have traditionally done and what I have seen done quite commonly is setting up on cookie sheets. It's so easy. You have a specific cookie sheet for each type of thing that you're doing, like for the birth or for resuscitation or for suturing, whatever. And you have it set up so that I have seen this happen. For example, I was at a birth not long ago where the woman was planning to birth in the water. We had everything set up around the water, and she got up to go to the washroom and got on that toilet, and she was just doing great on that toilet. And when she was in the water, things just weren't happening for her, you know. And so not everybody's comfortable with the water once they've decided to do a water birth, and it's okay. It's just, there's options are forever open to that woman, almost always, except for in the case of some emergencies. So she's on the toilet. She's really comfortable there. It's a fairly small space, conducive to her endorphins being high and her being able to stay in that sort of labor land space, which is really conducive to healthy outcomes for women. So that cavey kind of, it's like you think of a mama bear, you know, where do they want to birth, you know. And so oftentimes they will do that. And so what I'm getting at, though, is that you're going to take these cookie sheets, they're so portable, right? It's not like you have everything on a table. Like, oh no, we've got to get all this stuff off of the table now and bring it into the bathroom. Where are we going to put it? You know what I mean? There's no tables in the bathroom. It doesn't matter because you've got your little tray with all your birthing instruments. If you had to cut that cord on the perineum because it was, you know, you had a couple wraps, you'd have all your instruments there. For some reason you need the oxytocin or your herbal tinctures or whatever. You've got everything accessible. So you can just bring those trays in. I've had to move the oxygen. Usually I'll just put the oxygen right near the door so that there's still pathways going both sides. I'll have the suction machine on this side. The suction machines, so that you know, they do plug in, and oftentimes the midwives will want you to plug them in, but they also have batteries, so they're portable. Some midwives still use the bulbs. They're very comfortable with that. They've been using it for years, and so you have the bulb ready to either suction yourself, and that can be one of your duties, is to suction that baby. So you need to know that you always suction the mouth first and then the nose. And the way you can remember that is M comes before N. And you suction both nasal passages. So you may be asked to do that. And you always need to have that material accessible for the midwife to use or for yourself to use.